Hello, everybody. Today we're going to talk about schizophrenia. So, schizophrenia, what is it? It's among one of the most stigmatized and misunderstood mental disorders out there. Movies and media have led to many false common beliefs about schizophrenia, including that someone with the disorder may have multiple personalities, that they're violent and dangerous, that they can't hold jobs, and that they're not smart. We're hoping that by the end of this video, we have successfully promoted a better understanding of what schizophrenia really looks like, and we'll go ahead and we'll debunk the myths. So, with schizophrenia, there are positive, negative, and disorganized symptoms. Positive symptoms are anything added to a person, such as hallucinations and delusions. Negative symptoms are symptoms where something is taken away from a person, such as social withdrawal and anhedonia. And disorganized symptoms are symptoms that don't really fall into either category, such as disorganized speech or behavior. In order for a diagnosis to be made, according to the DSM-5, or the Diagnostic and Statistical Manual of Mental Disorders, two of the following symptoms must be present: a delusion, hallucination, disorganized speech, disorganized behavior, or negative symptoms. One of them has to be either a delusion, hallucination, or disorganized speech. Delusions are strongly held beliefs someone has about the world. A very common one is that someone is out to get them. Hallucinations are when someone perceives a sensory experience that isn't really present, like hearing voices or seeing things that aren't there. And disorganized speech can be categorized as speech that doesn't really flow with the conversation. When it comes to etiology and risk, we have environmental factors, such as complications during pregnancy like maternal infection, or stress on the developing embryo during neurodevelopment. We have neurobiological factors. One is that there are really large brain ventricles and reduced gray matter volume for people who have schizophrenia versus in healthy patients. And there are genetic factors. So we see that there's a heritability of about 0.7. And for people with schizophrenia, monozygotic twins are at a higher compatibility, so identical twins. They're at 45% versus dizygotic twins, which are at a 12% compatibility. So there's been some more research going more in depth on genetic factors relating to schizophrenia. Epigenomic studies found that there are differences in gene positioning or loci involving glutamate and GABA neurotransmitters, which respond to psychosis. GWAS studies on over 100 schizophrenia-related loci found that schizophrenia may be a polygenetic disorder, meaning it's caused by a combined action of more than one gene. In addition to that, there have been genetic studies implicated by postmortem studies that found that lower levels of synaptic proteins, pruning, dendritic spines, and GABA are closely related to markers for individuals with schizophrenia. In terms of treatments, many people living with schizophrenia follow a treatment that's lifelong, even if symptoms have subsided. Medications and psychosocial therapy are utilized to help manage the condition, and hospitalization may be required in some cases. Typically, treatment is laid out by a psychiatrist who has experience in treating schizophrenia, but those often involved in the team are psychologists, social workers, psychiatric nurses, and case managers. Antipsychotic medications are the most commonly prescribed drug for schizophrenia treatment. They're believed to control symptoms by influencing the neurotransmitter dopamine to the brain. Other medications used include antidepressants or anti-anxiety medications. Some goals for psychotherapy are normalization of thought patterns. Learning to cope with stress and recognize early warning signs of relapse can also help manage schizophrenia. Vocational rehab and job support are also important factors in terms of treatment programs. It helps people with schizophrenia prepare, find, and keep jobs. Then we also have the improvement of social skills. It improves communication and also social interactions. It can improve their participation in daily activities, and so family counseling is also helpful because it assists and educates families dealing with schizophrenia. So the stigma tied with schizophrenia is really real. There was a study that took place in Italy. There were 6 groups. 3 groups were diagnosed with schizophrenia, and 3 of the groups were relatives of individuals who were diagnosed. Psychologists asked certain questions and created a coding scheme, and with the coding scheme, they were able to establish 4 dimensions of stigma that revolved around schizophrenia. They were access to social roles. It was caused by discrimination the patients went through of their daily lives, causing them to feel neglected. Internalization of stigma, because the patients were aware of the negative comments and the negativity around schizophrenia itself. It induced self-discrimination. So there was the quality of mental health services, just the inequity of treatments, institutions, and all of that revolving the mentally ill, plus the public image of mental health. So the lack of info being wrong. Schizophrenia is never really done correctly for the media. So a good example of this is the movie A Beautiful Mind. It may cause others to think that people living with schizophrenia are dangerous to others, that they're incapable of normal functioning, or that they're unsuccessful, but it's not true. So to close out the video, we're going to revisit those myths at the beginning. So one of them was that schizophrenia means living with multiple personalities. It likely comes because schizophrenia literally means split brain, but it doesn't have anything to do with like multiple personality disorder. Another is that people with schizophrenia are violent and dangerous, and although they can act unpredictably at times, they're not violent. They're actually most likely the victims of violence and sometimes harm themselves. The other was people with schizophrenia cannot hold down jobs. This is also not true. When they get enough treatment and they're stable and functioning enough, they can definitely maintain the right job for them. And the last was that people with schizophrenia are not smart. And although they may have troubles on tests, on attention and learning, maybe memory, they're creative and smart. One, Josh Nash, living with schizophrenia and was a Nobel Prize winner. So yes, I hope you guys enjoyed. Happy Mental Health Awareness Month. And yes.